Mental Health Week begins Monday, and this year's theme is Unmasking Mental Health. Often people living with challenges hide behind a metaphorical mask to protect themselves from judgment and discrimination. But the heavier the stigma, the heavier the mask can become, and the more isolated people can feel. To talk more about Mental Health Week, we're being joined now by Dr. Jennifer Russell, a psychologist and the chief of the Department of Psychology at the MUHC. Dr. Russell, welcome to the show.
Thank you so much for having me.
So mental health was not really something that we talked about, say, 20 years ago, but that has changed thanks to things like Mental Health Week. In your opinion, what are some of the challenges to unmasking mental health that remain today?
Well, I think you're right that in recent years, particularly post-pandemic, we're seeing much more discussion about mental health. There's reduced stigma. Certainly social media has played a role in this. But the challenge is still real for people living with mental health. As the theme of Mental Health Week suggests, people do tend to hide behind masks. They worry about judgment. They worry about discrimination. And so this week is such a great opportunity for us to raise awareness, try to reduce stigma, and keep the conversation going.
Your specialization is in anxiety and mood disorders. Are there a lot of people who have these issues and aren't getting help?
Absolutely. Every year, 1 in 5 Canadians will struggle with their mental health. And so that's over 5 million individuals. Many of them have anxiety and mood disorders.
What difference can a psychologist make in someone's life if they're suffering from something like anxiety?
Well, I will sometimes say a psychologist can't do really much at all. Only to say that really it's up to the person themselves to make the changes. What a psychologist can do is really to help support, guide, and accompany someone through making the types of lifestyle changes and cognitive and behavioral changes that they need to make to overcome a difficulty.
Are there dangers of not being treated or not addressing things like this?
Absolutely. I mean, we always recommend people to, seek help early, and prevention is often half the cure. But certainly, if a person is struggling, it's so important to reach out as early as you can. These difficulties are easier to treat the sooner we catch them.
You mentioned social media earlier, and I see a lot of psychologists or people fronting as psychologists on my social media reels and, of course, on YouTube a lot, too. I'm wondering what you think about how big that has become.
I think there are pros and cons to it. It certainly has become very big. People are interested in mental health, and social media becomes like a safe space for people to get information, to ask questions. On the positive side, I think this really does a lot to raise awareness and get conversations going, help people feel connected with others and maybe understand themselves better. But you're right that some of the information that's out there is coming from perhaps less medical sources. And so not all of the information is equal.
So how does the role of a psychologist in a hospital differ from one in private practice? I know that's something you're particularly interested in.
Yeah, so it differs quite a bit. In private practice, we're usually doing more individual work, whereas in hospitals, psychologists are working as part of larger interdisciplinary teams. So working with nurses, with doctors, with other healthcare professionals. Psychologists in hospitals also are working not just with mental health, but also with physical health. And it's a good reminder that mental health is health. And so chronic pain, helping people kind of cope with, adjust to diagnoses, reducing the impact of chronic illness.
Interesting. What's your advice for someone who either needs some help or knows someone who needs some help? What should they do? What can they do?
Well, it's important to stay connected. Don't isolate, don't hide behind that mask. Ask for help. Asking help really is a sign of strength, not a sign of weakness. Speak to your friends, speak to a doctor, reach out to a mental health professional, and get help early. Help is there.
Well, Dr. Russell, thank you so much for coming on the show today and sharing this all with us for Mental Health Week. We appreciate it.
Oh, thank you. It was my pleasure.